I've pursued and I've looked at the CV of the Dr. Baraza. Having worked at Kenyatta Hospital as a registrar, Mata Hospital as a promotion, worked at Eastern Deanery as a physician and promoter, and then straight to WHO. I have no doubt on your experience, but I have a serious concern of where you are coming from and where you are getting into. And I think Cosin alluded to that. We want to hear you, how you will transit. Having been in the medical fraternity for the last 20 years, where you are coming from is where things are done as the policy of the institution. You are joining government whereby complex law, interest, politics carries the day. Madam, with all due respect, I believe you are getting into the Ministry of Health, whereby we have several departments, starting with the doctors themselves, starting with the nurses, the procurement agency, KEMSA, the programs, everything. I want to hear from you your management skill, or now you'll transit from that set mind of a straight line of thinking, and no wonder you are telling us every time consultation. Here, it is whereby the law applies. The law which is applied at KEMSA is not the same law which is applying with the doctors, enumeration and hiring. So my question starts with, how do you tell Kenyans you'll streamline supply and demand of health communities in this country to the grassroots level, putting in mind we still have a devolved government? Secondly, from the international community where you are coming from, there are those policies and guidelines which have been given to this country we must adhere to. One, Honorable Mukami talked about Gavi and vaccines. You know very well Gavi has been supporting this country for many years to provide vaccines and other commodities. But as a government, we have always delayed to pay these supplies, yet endangering the young newborns and the future of this nation by not being vaccinated and exposing them to diseases like polio. What is your take to how to progress on that? Thirdly, as a country, we are binded by all international commitments, starting with the United Nations Convention on on health policies. And I want to hear from you, how do we get out from donor-funded health programs in this country to a government-funded programs in this country on TB drugs, TB diagnostic tools, HIV drugs, HIV diagnostic tools, vaccinations and distribution of vaccinations to the country, malaria drugs and malaria transmission diagnostic tool. And last, how do you coerce the seamless working relationship between the Ministry of Health and the county government, putting in mind the largest budget within the ministry remains at the national government, and what is required to be transferred to the county government, it is transferred. And lastly, what policy are you going to use on relationship on working with the county government and the CECs at the county level to ensure that Kenyans does not suffer anymore for lack of health services in this country? Thank you.
Quite a mouthful. Can you answer that?
Thank you, Honorable Member.
Honorable Mule.
Honorable Mule, my sincere apologies for that. And indeed, I sense a lot of passion in matters health. And if hopefully given the opportunity, I believe we'll work together to address some of these pertinent issues. Yes, so again, this will be a priority in my agenda to understand the situation and come back with interventions, seeing that I will be new to the ministry. So the issue of supply and demand, again, we need to strengthen the information system. I think my mind has been focusing on that because I have seen it work. I have seen it work in various organizations that I have worked in. I have seen it being rolled out. I've seen the teething effects, but I have seen the impact it has had. It has reduced on costs, it has improved quality, and it has enabled people to track and see where their stockouts, among others. So we can be able to track the supply of commodities up to the last mile. Yeah? And then we can be able to also monitor other services. So I am an advocate of the digital platform because the human-to-human interface is what is bringing challenges, I believe, in our country at the moment, among other things. So for the vaccines and commodity delivery, yes, we need to allocate budgets to support this, and then we can have pooled procurement of vaccines. We'll also deliberate with the vaccine programs that are currently here, the vaccine production, and see on their effectiveness and their efficiency and the cost implication. So coming from my background, I know the concerns, the teething effects of vaccine production, and I know the members, the nominated committee wanted me to talk about vaccine production, but I think it is important that we go in depth and identify all these things before making commitment. In terms of health policy, for the dwindling donor funds, one of the areas we can consider is health insurance, but again, we need to have community ownership. The community need to embrace it because, you know, there are taxes involved. So we'll need to educate them and make them embrace it with your support, with the county government support, the stakeholders, the partners. I believe we can make this successful. And equally, there are some programs which are again feeding into the universal health coverage, including maternal to child health programs, the TB programs, and so on. So we can see how to work as a team and synergize our efforts for improvement of services in Kenya.
As we sit here, the Kenyans who are watching, and they have been sending some SMSs to almost all of us. A few of them, they say, in case you're approved, embrace biotechnology and diagnosis, harmonize salaries of health workers. They earn different salaries while doing the same job. Somebody else says there's a program called Edu Afia for students. It was suspended because of fraud instead of punishing the fraud. Another one says advise her to solve UHC staff menace. They get only half salary for full work. Another one says Linda Mama must come back. That's what Mishi was saying. Another one says ensure SHIF covers ICU costs which are unaffordable by all Kenyans. Another one says, how will you handle monkeypox disease if you are confirmed? And you had answered that. Yes. Yes, Mule.
Chair, I did hear touch on the issue of diagnostic tools as recommended by the UN on the TB, HIV, and also supply of vaccines and drugs for malaria and the diagnostic tools for malaria, please.
Yes, go ahead.
Yes.
The ones I've given here are just comments extracted from SMSs. Can you answer the members?
Thank you, Honorable Muli, for the question, and through you, Honorable Chair. Yes, this is an agenda that will also be priority in my list to be able to identify the situation and the gaps and the interventions therein. Regarding monkeypox, I'm happy to say that within this year, we've had multiple countries within the Afro region that have had monkeypox. And I have been part of the team that has been supporting the countries. And so I believe that this, with the support from the National Technical Working Group, we will be up to task to support the country to address monkeypox in terms of readiness and response in Kenya.
Dawood, what was it?
Thank you, Mr. Speaker. I want to follow up what my colleague, Honorable Imase Mary, asked about facilities which have not been opened. A case in point would be even Meru, where there is a 5-story building which was done by Honorable Kiraito. He was the governor. 3 years down the road, it's never been opened, and there's congestion in Meru level 5. So there are many places like those. Do you think once you get in, you will say it is not national government, it is county government? What would your position be on those unopened facilities?
Take also from the Deputy Speaker.
Dr. Deborah, also some concerns that have been raised by members of the public who've sent me messages. They are saying that the community health promoters are being paid timely from the national government, but the contribution of the county governments comes in very late. I think they've been said that Isiolo County, they are currently on strike because they have not been paid. Nyamira County have not been paid for 9 months. So how will you ensure that the county governments are also able to make their payments as government does, national government does its contributions?
Thank you very much, Speaker. Dr. Deborah, just 2 quick questions. One, there has been worry of staff of NHIF transitioning to SHA or SHIF. They are worried about losing jobs. We have a law that is in place, but they're worried. What is your take on this? Are you going to transit all of them? Are you going to ensure all of them have jobs, or others will lose jobs? This is a concern of NHIF staff. How do you respond to them? And secondly, what legislative proposals do you have to strengthen the health sector as you take over, if approved by this committee? Do you have any legislative proposal you want to make here? Because these are legislators and they will support your agenda. Do you have any legislative proposals going forward so that we can strengthen the health sector? Or what gaps are there in the law that you may want to fix to make health a better?
Thank you very much, Honorable Owen, and for the questions that have been raised. So I will start with Honorable Dawood's question regarding facilities and their capacity. It is critical for us to monitor the capacity of healthcare facilities to ensure that they are up and running and they are offering quality services. And so it is critical that we conduct routine assessment to identify gaps and come up with intervention. I hope to work together with the county government in terms of identifying the gaps and supporting, because healthcare, the health system is not just the infrastructure itself. It is the commodities, it is the services, it's the human resource. So we need to look at all those things and ensure that our healthcare facilities are up and running. And that is a task that I would wish to take up, and in consultation with the counties. Again, the community health promoters, indeed, they are a critical component and a pillar for health service delivery. They are the ones who go to the community, supporting preventive, promotive, and rehabilitative activities. And so discussions with the county government on the gaps as to why the community health promoters are not receiving their money is really important, and it will again be part of my agenda. Regarding the NHIF, I'm still new to the ministry. I will need to review the HR capacity, the number of human resource that is required for the new insurance, but an intervention can be too much and move the HR, depending on their roles and responsibility, to the new area. So again, this is an agenda that we can have with the technocrats to see where the gaps are and how we can move the NHIF, because it is very sad when, the sole provider of a family loses their job. And so this is something that we need to support our NHIF staff.
Saying that the law that was actually passed in Parliament on the social health insurance and social health authority says that they will all be assessed. And if you have the skill set for the new system, you will be taken. So there is no guarantee. Don't set yourself up. When you get there, you'll get into trouble that you promise you'll hire them. They will be all reassessed. And if they are suitable, yes. If they are not, they will not be taken. Because it was said that in NHIF, there are some people even who are geologists and yet they're working there, or nuclear scientists. So their skills don't match the work that they're doing.
Thank you, Honorable Chairman.
You will be the last.
Honorable Chairman, Kenyans have really been crying on the issue of public participation, and that there's so many decisions made in terms of Ministry of Health without their knowledge. My question to the nominee is, are you conversant with Article 232 of the Constitution on the values and principle of public service, and to what extent does your personal and work experience reflect these principles? I thank you, Honorable Chairman.
Yes, Majority Leader.
Thank you, Chairperson, Chairman.
Yes.
My last one, CS nominee. To me, you come across as a very young, diligent professional, but I have doubts in my mind. Will you be able to manage the cartels in Afia House? Because the home of cartels is Afia House. It was Christian Mafia House some time back. Do you have what it takes to fight the corruption cartels in Afia House, in NHIF, the cartels in KEMSA? Do you have what it takes?
Go ahead and answer.
Mr. Speaker,
Yes.
I think we also need to be fair to our time and the nominee. That question has been asked several times, so we can't keep on repeating the same. So I think honorable members must be attentive.
Yeah, it was asked actually.
Speaker,
Yes.
Speaker,
Yes.
the question of the mafias and corruption was asked, but I think to be fair to the majority leader, he's asked about what he thinks in terms of demeanor. I think it is just more in her direct strategy. And even you respond to that, I would tell you that the mafias always also say, we have seen many come and go, including the most recent one. So I think as much as that question has been asked, she can respond to it.
Isula is taking over my job.
Women power.
Let's take Raso. Let's not do another round. Raso, just. Do you have the capacity, the ability, the will, and the strength to fight and resist the mafia at Afia House? That is the question.
To have thick skin.
Thank you very much, Honorable Chairman. Daktari, maybe mine is just one quick question. You have worked at the WHO, and there's prescribed number of doctors per patient within a population. What is the standard And how far are we as Kenyans? Because the UN says 1 policeman to 400 Kenyans. What do they say in terms of doctors, both at the national and the county level per population? Thank you, Honorable Chairman.
Thank you, honorable members, for the questions. With regards to public participation, yes, this is a very pertinent issue of which I am passionate about. I believe there's need for community ownership. And what I see is that the highlight is the taxation of 2.75. We are not talking about accessible, affordable quality of Kenya for all Kenyans, including the vulnerable and the ones with disability. So there's need for robust communication. We need to strengthen communication to the community so that they embrace and they own this initiative. We need to gather feedback and see how we can address the challenges. We need to look at the misinformation and counter it. We need to engage the community. And one of the people in the community that we can use are the community health promoters. And so I think that, or I believe that the risk communication, community engagement, addressing all these things is really a critical highlight before embarking on this journey. Regarding being able to manage the mafias.
You can't manage them, you confront them. That is what you have been asked. You eliminate them.
So, Honorable Chair.
Your colleague who came earlier said you neutralize them.
First of all, we can look at prevention than treatment. And one of the areas is the early warning indicators. We can use a digital platform, yeah? We can use, open tenders or transparent tenders. And we can use independent bodies to monitor this. And engaging the EACC and other bodies in this.
Go ahead.
In the discussion. So I think we need to strengthen.
You have the courage and the will, that is the question,
yes,
to confront the mafia,
yes,
and defeat them.
I will hold my office with high professionalism, yes, and high integrity.
Good.
But she can't manage and treat mafia. She has to deal with them head on. She has said that she's going to manage and treat. We can't deal with mafia as like that.
I think she's understood. You can't treat the mafia, you fight them. They are a criminal enterprise. And exactly.
I think the Honorable Mukami did not get the nominee right. She said there can be preventative treatment. And my understanding was that preventative in terms of preventing corruption, if I got her right. And what she was talking about, curative, I think is what she was now explaining in terms of working with other agencies. It's only that she's a doctor, she's using medical parlance.
Okay. The last question from Russell. What, from your UN perspective, is the doctor-patient ratio in an average society like Kenya?
No, we are not quite there, but we are doing well compared to other countries in Africa. So we need to look at improving the HR capacity, not only for doctors, but other cadres such as the nurses. Yes.
What are the numbers?
The ratio. What's the ratio?
I will have to confirm the ratios. Yes.
Yes. Okay. Now, a few formal questions. Other members, a few formal questions. Do you hold any leadership position in any political party?
No.
Have you ever been adversely mentioned in any integrity-related report or investigation?
No, Honorable Chair.
What is your net worth in terms of wealth?
Okay. So my net worth is a combination of mine and my husband, and it's 455,845,320.
You and your husband.
Yes.
Honorable members,
That is, Mr. Speaker.
Yes?
Mr. Speaker. Mr. Speaker. I think
Yeah?
because
Yes, Caleb.
yeah, because this is a house of records, so I propose to divide into two.
Chairman, it is not necessary to be divided into two. It can be another
Don't
way.
break
around.
families.
Yeah.
If they own it jointly, if there's a dispute, the courts will decide. You said how much?
455,845,320.
Yes.
Okay, millions.
Yeah.
Yes. Honorable members, the nominee, according to the clerk, has submitted her papers and are all in order. 7 memoranda were received from various people, and in her written response, she answered all of them. You are now released. Yes? Yes.
Yes.
You are now released to go back with your original documents, which will be given to you by the sergeant behind you. And have a good day.
Thank you. I'd like to again thank His Excellency the President for nominating me as Cabinet Secretary, Minister of Health, and also for the nominated committee for giving me the opportunity.
Appointments committee.
The
Appointments committee.
appointment committee for giving me this opportunity to also present myself. And I am happy to bring my expertise and serve the people of Kenya.
Good. Bring the next nominee. Members, do you want to break and resume at 2? How many minutes? 10 minutes. Lunch is served in the boardroom of the commission. Those of you who are hungry.
We've just eaten a snack.
Yes.
5, yeah.
10 minutes. We'll do lunch after the next nominee.